The chapter Sex Linked Inheritance consists of all the types of sex linked inheritance. Out of that, X linked inheritance is well understood with help of hemophilia. This disease is discovered by the scientist John Cotto in 1803. Understanding of hemophilia is most important for its prevention as well as the curing or coping with hemophilia. Hence, it is included in our syllabus. This disease is genetic disorder, that is, it is developed due to the problem in genes. It is right from the birth. Hemophilia is lifelong inherited bleeding disorder. In hemophilia, one of the clotting factor is either partly or completely missing. This factor is anti-hemophilic globulin. People with hemophilia take a longer time than normal for bleeding to stop. Means normally person requires a clotting time is 2 to 8 minutes after cut or wound. But in this disease it requires minimum 20 minutes or it may increase up to the 24 hours and bleeding is continuously there, due to which it is called as bleeder's disease. This disease first discovered as a mutant in Queen Victoria family. Hence, it is also called as royal disease. The symptoms of hemophilia are developed in infancy and they contain easy bruising even after mild harm. Means with the mild harm, any other normal children not develops bruising, but hemophilic children develop the bruising. The second one is painful swelling of muscles and joints as a result of internal bleeding. Means internal bruising or internal bleeding is there in these patients, and if there is a injury or cut, prolonged bleeding after injury is seen. Minor surgical operations are also showing prolonged bleeding. Next one is blood in urine. Without treatment, prolonged episodes of bleeding into the joints may bring about long-term damage and eventually may result in deformity of the joints, and finally it becomes a very painful to these patients or the hemophilic persons. There are the two types of hemophilia on basis of the clotting factor. These clotting factors are of two types and they are called as type A and type B. Type A hemophilia refers to lack of clotting factor, factor number 8. Around the 80% of hemophilic cases suffer from this type, and out of these 70% of them have a severe form of hemophilia. The second type is hemophilia type B, is known as a Christmas disease where the patient lacks a clotting factor 9. From about 20,000 males born around the world, every person is sufferer of this disorder. Depending upon the amount of clotting factor available in blood, both A and B can be divided into three groups as mild hemophilia, moderate hemophilia or severe hemophilia. The factor percentage is ranging from 5% to 40% of normal clotting factor is called as mild hemophilia. If it is in between 1 to 5%, it is considered as a moderate hemophilia, and less than 1% clotting factor is there, then it is called as severe hemophilia. The causes of this disease is genetic. This is a reason for this disease. It is inherited, and there is a defect in one of the gene in X chromosome responsible for clotting factor. Hence we call it as a X-linked disorder. It is passed on from mother, as generally males do not have the second X chromosome and thus are not able to fix the one that is defective. Females possess XX chromosomes while males possess XY chromosomes. Females generally are carrier of hemophilia but not the sufferer of the same. Females only suffer from hemophilia if they have an abnormal gene of chromosome which is rare. The inheritance of this disease shows a crisscross inheritance. Crisscross inheritance means the inheritance from the father to his daughter and not to son, and from the daughter it goes to grandson. Means from male to female child and from female child to her grandson male. Typically males possess 2 X chromosomes, females possess 2 X chromosomes, and males have X and Y chromosome. Since the mutations causing the disease are X-linked recessive, a female carrying defect on one of her X chromosome may not be affected by it, as the equivalent dominant allele on her another X chromosome is there, and it should express itself to produce a necessary clotting factor due to X inactivation. Therefore, heterozygous females are just carriers of this disorder. However, the Y chromosome in male has no gene for factor 8 or 9. If genes responsible for production of factor 8 or 9 present on male's X chromosome are deficient, there is no equivalent on Y chromosome to cancel it. So the deficient gene is not masked and disorder will develop. This inheritance can be explained with help of this diagram. X-linked recessive inheritance. In the first cross we see the mother is carrier, that is it has the first chromosome which is having defective gene and male is unaffected. In the first cross we see the carrier mother's X is going to carrier daughter, and another X going to affected son, because son gets only one X which is affected and other Y is normal. Hence it shows the diseased condition. If the case in the second right side diagram, you can observe the affected father which has a 1X which is carrying a defective gene, mutant gene, due to which that X is going to both daughters which are became a carrier one, and the son both are unaffected because Y chromosome has no any mutant gene. Red color indicates the mutant gene. This is inheritance, and crisscross inheritance means this is inheritance up to F1 generation. And for the crisscross inheritance we can see the next diagram having a F2 generation. In this diagram you can see the mutant gene if present in a father, it is going to its daughter. Dotted line indicates the transfer of mutant gene. From the father it goes to daughter, and again from the daughter after its her marriage it is going to her son, that is grandson. It is called as a crisscross inheritance. This inheritance, male receives single X chromosome from his mother, and the son of healthy female silently carrying the deficient gene will have 50% chance of inheriting the gene from her, and with it the disease. And if his mother is affected with hemophilia, he will have a 100% chance of being hemophilic. In contrast, for female to inherit the disease, she must receive two deficient chromosomes, one from her mother, another from father, who must therefore be a hemophilic itself. Hence, hemophilia is expressed far more commonly among the males than females, while XX females are far more likely to become a silent carriers. Prognosis and precautions for this disease. If you have got hemophilia, you can lead an active life but need to prevent sustaining any injury. Must be protected from all types of injuries. Actions like swimming, running, walking are valuable and possible, but the contact sports, for example wrestling, football, should be prevented because any contact game or sport increases the chances of internal bleeding. Routine dental care is essential to prevent the danger of bleeding from the inflamed gums. Any possibility which can create the bleeding should be prevented. If you have a family history of either illness, you should get a medical advice when planning a pregnancy or when planning a marriage. Both families should be studied and precautions should be taken, and for that purpose genetic counseling is most important, awareness is most important. This is true for not only true for hemophilia, but it is true for all the genetic disorders, that is genetic disorders which are present in family should be understood, should be studied, and avoided the marriages between two such a suspected families. And for that purpose awareness is most important. The awareness of this disease is created, and for that purpose the World Hemophilia Day is there on 17th April. And in this way such a genetic disorders may be controlled. They cannot be eradicated, but control is possible, prevention is also possible.